All right, Pathology 2, week 4. We're covering endocrine system and endocrine system disorders. Stop me if this starts sounding unfamiliar. All right, I figured we would start with a review of the glands of the system, what the glands do, what they produce, and then we'll start getting into some specific disorders. We'll start with the thyroid gland. The thyroid gland is kind of a bow tie shaped gland, sits right here in the front of the throat. The main hormones that it will produce are triiodothyronine, which is called T3, thyroxine, which is also called T4, and calcitonin. You've probably heard of calcitonin when you talked about the skeletal system. Calcitonin is produced in order to increase blood calcium. So we pull calcium from the bones and put that into the blood, and now the blood has more calcium, and that calcium can be used wherever it's needed. On the posterior aspect of the thyroid gland are 4 small lobes. So they're kind of colored here, kind of yellow colored. That's the parathyroid glands. The parathyroid gland produces what is called parathyroid hormone. That is the name. I did not make up the words. I'm just reporting the facts. Parathyroid produces parathyroid hormone. Yes, that is really its name. So cutting deep into the brain this time, we have the pituitary gland. It kind of dangles like a cherry from a stem, and it's located just about in the geographic center of the brain. It's like behind the eyes, right in the sella turcica of the sphenoid bone. So the anterior and pituitary or posterior pituitary lobes are producing separate hormones. So the anterior pituitary, we have growth hormone. This is released a lot during puberty and adolescence. Prolactin. Prolactin is responsible for the production of milk. Thyroid stimulating hormone stimulates the thyroid to produce all the various things that it produces. Adrenocorticotropic hormone affects the adrenals, but I do want to take a moment to talk about this word. Those of you who have taken classes with me know how super passionate I am about medical terminology and how cool it is that we have this language that's like designed to be super precise and not give any room for misunderstandings. So adreno refers to the adrenal glands. Cortico refers to the cortex or the outer layer. If you think about cutting an orange in half and opening it up, you've got the outer rind and then the inner, like the meat portion of the orange, the part you actually eat. That kind of thing you see over and over in anatomy between the medulla and the cortex. So the medulla will be the central portion, the cortex will be its outer covering. And in the adrenal glands, the medulla and cortexes are producing separate things. So let's just jump to the anatomy app really quick. I'll show you a few examples in anatomy where you see the same kind of thing going on. Do you guys remember your long bones are hollow? And that central cavity was called the medullary cavity. Do you guys remember that word? Yeah, Chelsea does. So the medullary cavity gets its name from medulla, and then the outer layer of hard bone was called cortical bone. That's related to a cortex. So this is just a small kind of cut section of the adrenal gland, which would sit on top of the kidneys. And you can see kind of up at the top here, highlighted in pink, you've got that outer layer, that would be the cortex. And then deeper within, you have, oops, my fat fingers, the medulla. So you've got the rind type portion and then the meat type portion. So adreno, cortico, So the adrenal cortex, the outer layer of the adrenal cortex, and then the word tropic, almost like tropics, like Florida, like the tropical zone. The word tropic means changing, and that's what the tropics refer to as the rapidly changing weather that goes on there. So adrenocorticotropic hormone, the name is telling you this is a hormone that changes or affects the cortex of the adrenal glands. The name is telling you exactly what it does. And I love it. Follicle stimulating hormone, unfortunately, is not the cure for baldness. Follicle stimulating hormone is stimulating the ovarian follicles to produce ripe ova, as well as it's used in the testes to produce viable sperm. So it's used in sperm and egg production. Luteinizing hormone, yet another hormone that's used during the ovulation cycle. Melanocyte stimulating hormone is a hormone that stimulates melanocytes, which are responsible for giving you skin pigmentation. So exposure to direct sunlight, for one thing, will increase the production of melanocyte stimulating hormones. That's what's responsible for getting suntans. So all of that really cool, fun, fascinating stuff is happening in the anterior pituitary. The posterior pituitary just makes two hormones. It's your antidiuretic hormone, which is used in water retention with the kidneys, maintaining water balance, and oxytocin. Do you guys know another name for oxytocin? Have you heard of this one before? Is someone else going to say it? No one's going to beat me to it. Oxytocin is the love hormone. It's produced during breastfeeding. It's responsible for the letdown of milk. It's also produced anytime we emotionally bond. So it's produced when you hug your kid. It's produced when you see the one you love. It's produced when you pet your pets, like pet your dog. It's also released in great quantities during orgasm. So oxytocin is responsible for all kinds of really fun emotional bondings. We produce oxytocin in moms when they're breastfeeding. We also produce oxytocin in the baby while it's breastfeeding. And the idea here is chemically, you're creating this kind of addiction between the two, which is what starts to chemically form the biological bond between mother and child. They literally start to kind of become addicted to each other from an oxytocin standpoint. Okay, and you guys stop me if you have questions, just shout out at me, it's cool. All right, so the pituitary, we said, was attached like a cherry on a stem. So the stem on the other end would be connected to the hypothalamus. The hypothalamus is kind of the primary relay station where all the signals that are coming in get sorted. Some of them can be dealt with there. Others need to be referred to other areas of the brain for processing. So the hypothalamus takes in all that raw information and starts disseminating it to wherever it needs to go. It's kind of like the badass secretary of the brain. We also have endocrine functions here. We're also producing hormones. So some of the ones of note here are the thyrotropin stimulating hormone, which produces changes in the thyroid. The somatotropin hormone, which creates changes to the body overall. Corticotropin factor, which is produced or released in response to cortisol, the stress hormone. And prolactin inhibiting factor, which starts to stop the production of breast milk. So if one chemical is going to turn it on, another chemical is going to turn it off. The thymus gland. This one's often overlooked because it starts to deteriorate as you become an adult. By the time you reach middle age, it's got usually about half of its function left. And by the time you move into old age, like proper old age, it has withered away into just a lump of fatty tissue, not really doing anything. The thymus sits just anterior to your heart, between the heart and the sternum. And when it's functioning, when you're younger, The thymus is an immune organ mainly. So you have thymosin, thymulin, thymopoietin, thymic humoral factor, lots of really fun things that this produces, most of which are involved in kind of getting your immune system up and running through childhood and adolescence. And then the thymus becomes less and less functional as we age. So back to the adrenal glands that we talked about, sitting there looking like little hats on your kidneys. We have the two portions to the adrenal glands. You've got the medulla, which is the meat part, and then you have the cortex, which is the outer layer part. The cortex is producing mineralocorticoids and glucocorticoids. These are all categories of hormones, which are, when you see that cortico, we're using fat, a fat molecule, as the basis for that. Hormones can be made out of fats or proteins or amino acids. Androgens and estrogens are the masculinizing or the feminizing hormones. So these guys will be released not only in things like menstruation, but estrogen is what also gives the female body its feminine characteristics, and androgens are what give male bodies their masculine characteristics. The medulla, or the central portion, the meat part, is producing things like epinephrine and norepinephrine, which are more commonly known as adrenaline. And kidneys also have important endocrine functions. They're producing hormones like prostaglandins and erythropoietin, which is used to help maintain your red blood cell balance, as well as renin, which is used, again, for maintaining water balance. Pancreas, most famous for the two hormones that it produces, insulin and glucagon, which are both involved in raising or lowering blood sugars, as well as somatostatin. Testes are important glands for men. They produce testosterone and androsterones. These are, not only important for sperm production and semen production, but just also the maintenance of the masculine body, the body hair, the upper body musculature. You'll forgive me tonight, you guys, if I feel like I'm not in my element. I don't really feel like I've worked my way up to endocrine system because I haven't been, I'm just substituting for this class. So ovaries. Ovaries produce estrogens and progesterone. Not only are they used for the menstrual cycle, but they are also used and again, like creating the feminine body, the cinched in waist, breast development. So what all of these glands have in common is that they are producing hormones. Hormones are chemicals, first and foremost, but I also want to add hormone is a category, right? Hormones aren't certain things, they're a category of things. They can be created using several base ingredients. We have the steroids. So when you think about mineralocorticoids or any other kind of steroid type drugs, those are all going to be fat-based, lipid-based molecules. The body can create those on demand. So cortisol, testosterone, body can make those whenever it needs. Peptide hormones are made of chains of amino acids. That's in fact what the word peptide means. It's a chain of amino acids. You may also know the word peptide as protein. Proteins are chains of amino acids put together in specific orders, right? Building blocks of proteins. Does this sound familiar, guys? Yes, thank you. Thank you. And then the amines, which are made from specific amino acids. So one amine or peptide chains or lipids. This is how we make hormones. Amines, you're looking at specific ones like tyrosine. Tyrosine is used to make adrenaline, as well as thyroxine. So just some few examples. I don't need you guys to know all of those. I'm just giving some backstory here. The key hormones that I do need you to know, though, adrenaline, epinephrine, you'll need to know those. Those are made in the adrenal medulla. Adrenaline is a short-term stress hormone. Adrenaline, right? We know the idea of adrenaline junkies. It gets your heart rate up. It like clarifies your focus. But adrenaline wears off very quickly. Cortisol, the second of the stress hormones made in the adrenal cortex, so different place. This is the long-term stress hormone. This is the one that is continuously released when we live super stressful lives. We've got crazy bosses. I drive in a lot of traffic. I've been living through a pandemic for 18 months now. So cortisol in the short term has really beneficial effects. In the short term, it's anti-inflammatory. So if I'm running away from a bear and I twist my ankle, you will keep running from that bear. You know what I mean? You won't really feel that ankle until you start to calm down after a little while. It also depresses the immune system. Again, if I'm supposed to be running away from a bear, running for my life, I can't like stop and have an asthma attack. Things like allergies, all of those kinds of things will be dampened for a little bit. Your immune system kind of goes offline for just a few short minutes while you're trying to get away from this bear. The damage occurs in the long term when we live these super stressful lives. We never get massages, we never take a day off, I don't get paid vacation. And after a while, the cortisol starts to have kind of the opposite effect. Over long periods, cortisol starts to promote inflammation throughout the body. It starts to keep the immune system depressed for too long. Then we wonder why I have all of these inflammatory disorders, right? I can't understand why I keep getting the flu every year. Stress weakens the body. This is not controversial, right? We've known this for a really long time. Now we're just starting to see a few of the nuts and bolts as to how actually this works. Long-term exposure to cortisol promotes inflammation. This is why you'll start to see all of those kinds of conditions that end in itis, right? Dermatitis, I have arthritis. We depress the immune system. So no wonder why we're getting constant colds and flus, and you kind of catch something from everybody. And in the long run, it also is destructive to the connective tissue. It starts to wear your skin thin. Bones are also affected. Remember, bone is classified as connective tissue. So conditions that will affect connective tissue can very much include bone. So we start seeing weakened bones, we start seeing thin skin, we start seeing, inflammation spread throughout the body, and then, we feel crappy and we're sick. Get massages, it helps. All right, other key hormones, insulin and glucagon. Insulin is used to lower the blood sugar by allowing the sugar to be taken out of the blood and put into a cell. Glucagon increases blood sugar by pulling sugar out, usually of the liver. We start converting stored sugar in the liver into glucose and releasing that into the bloodstream. So insulin lowers it, glucagon raises it. Thyroxine is the hormone from your thyroid gland. Thyroid is kind of like, what's an interesting way to put this one? You guys remember the old steam engines, like for trains? And you wanted the train to go faster, you had to shovel more coal into the engine, so it had more coal, bigger fire, the train went faster. But if the fires died down, the train would start going slower. You guys are familiar with the concept?
I thought it had to do with your metabolism.
Say that one more time.
Your metabolism. Your metabolism.
Yeah. Yes. It's like the steam engine of your metabolism. As the thyroid becomes overactive, we start seeing the metabolism rise. People start getting super thin. It's hard to gain weight. They start to get really nervous and jittery. If the thyroid starts underperforming, then they start to get really cold easily. They start to gain weight. So yes, we use thyroxine to kind of stimulate the metabolism. And finally, growth hormones. These are produced in the pituitary. Growth hormones, they do exactly what the name would imply. They're used for healing injuries. They obviously grow new cells. And they're only released in certain stages of sleep, which is why teenagers really, really, really need more sleep than we're giving them. I will sign any petition to make school start later in the morning. Kids really need a lot of sleep. They've got a lot of growing to do. And all of those hormones are released during REM sleep. Okay, so we made it through the review stage, just recapping the system, recapping the glands and the hormones, just getting our heads kind of in the endocrine game. So today, the first condition that we're going to talk about, since we're talking about endocrine disorder, we're going to talk about diabetes first. Diabetes mellitus is diagnosed by prolonged high blood sugar levels. This can be due to abnormal insulin secretion or poor insulin effectiveness. So either you're not making enough insulin, or you're making enough insulin, but the insulin itself is defective and there's something wrong with it. Signs and symptoms include polydipsia, this is excessive thirst, and polyphagia, this is excessive hunger, polyuria, polyuria, thank you, excess urination. Other symptoms of prolonged disease are numerous, so as it goes on, there's a lot more, but these are the ones that usually start getting you in the beginning. Okay. Type 1 diabetes is often called juvenile diabetes because this is the one that is more often diagnosed in childhood. You may have had a friend or a classmate who had to check their blood sugar regulated, had to prick their finger, or they may have worn an insulin pump on their body. It's about the size of a pocket pager, would have been attached to their abdomen. Ultimately, this is an insulin-dependent type of diabetes. This is an autoimmune disease. The immune system, for whatever reason, has targeted the very specific cells in the pancreas that produce insulin and targeted them for destruction. So because they're under constant immune attack, they cannot do their job, so they do not produce insulin. Now the blood sugar is able to get way too high, and sugar can't just be taken into a cell, it has to be accompanied or bound to an insulin molecule in order for it to pass through the membrane. So if we don't have insulin in the system, then the sugar cannot be taken from the blood to go anywhere, so it stays in the blood. This causes a lot of issues. Nerves do not work well if there's too much sugar in the bloodstream. It starts to create chain reactions through other systems in the body. And the way that we control this is simply monitoring the blood sugar and injecting insulin as needed. So when we eat and our blood sugar spikes, we inject with an appropriate amount of insulin, which will remove the sugar from the blood. Type 2 diabetes is known as adult onset. This is the one that is typically diagnosed in usually around middle age. This is non-insulin dependent. The issue here is that either you're producing too little insulin as a result of exhaustion, or you're producing so much insulin and the cells of your body have become basically so tolerant of it, right? They've built up a tolerance to it that it's taking really, really excessive amounts of insulin production just to get your blood sugars back to normal. This creates, as you can imagine, if you were a cell having to work overtime to produce way, way more of your widgets that you're making, this leads to fatigue. This causes pancreatic fatigue. And when the pancreas becomes fatigued, its production levels just drop. So we go from requiring huge amounts of insulin to now I can't produce any insulin. So non-insulin dependent is often able to be controlled through diet and exercise, as well as other medications to control things like blood cholesterol level, like Lipitor, and things of that nature. So type 1 is juvenile, is autoimmune. Type 2, adult onset, non-insulin dependent.
Is type 1 genetic?
We don't know. That's a really good question.
I have a friend who is type 1 and her son also has type 1 diabetes. And she like knew when she was pregnant that it was something that was going to be possibly an issue and everything. And then once she had him, they did all the testing and stuff. So I didn't know if that was like, you're more likely to pass it on or not.
That's a really good question. I don't know for sure. Let's see what I can find really quickly. Yeah, we are unsure. 90% of people who develop type 1 have no relative with the condition. Genetic factors can predispose people to developing type 1. And there are certain gene markers associated with risk. So, yeah, again, the scientific answer is it's not really clear. I would say type 1 diabetes more so than type 2. So type 1 is an autoimmune disorder, and all autoimmune disorders basically have the same basic cause. Your immune system is no longer able to tell self from non-self. And every type of autoimmune disorder is kind of specified on a certain kind of tissue, but we don't really know where the error happens, like why the body mistakes normal healthy tissue that belongs here for foreign tissue. And I guess where I'm going with this is autoimmune disorders happen and we don't really know why. They're too many and too varied for it to be a genetic factor. Of course, certain people may be predisposed, but I wouldn't say it's a genetic disorder, like you're not predestined or predetermined to have it. I hope I
That
explained that
totally
clearly.
makes sense.
I hope I explained it clearly. I feel like it may have gotten away from me.
That makes a lot of sense.
Thank you. One more little thing, since we're talking about diabetes. The third type of diabetes is gestational diabetes. It's generally a temporary term that comes along when a woman is pregnant. It has to do with the demands of the fetus, and she's no longer able to regulate her own blood sugar, so she becomes diabetic. Usually, gestational diabetes will resolve itself after the pregnancy. However, sometimes it doesn't resolve itself, and it turns into type 1 or type 2 diabetes, one of the two. All right, diabetic emergencies. Diabetic emergencies are far more common with type 1 because they chemically, they cannot lower their blood sugar. Like they do not have insulin. So if they don't get insulin in them, their blood sugar remains dangerously high. So the solution for a keto or a diabetic emergency is to inject them with insulin. The problem is, I don't know if you've been watching the news, but insulin is like $600 for a little vial. It's really expensive. So you can't just like find it at the drugstore. Let me think. Diabetic emergencies. If someone's having a diabetic emergency, you call 911. Massage therapists are not trained nor qualified to really intervene in anything like that. They need to go to the emergency room. They need to be injected with insulin. It can cause nerve damage over the long run, so they really need to get themselves to a hospital. All right, ketoacidosis. This is a side effect that can occur in diabetic individuals. So without insulin, your cells can't burn sugar. And so instead, they start burning fat and they start burning protein in order to survive, in order to get energy. So the byproducts of fats and proteins are called ketones. And these are very acidic. So if you have ever heard of the keto diet, this is based on the same, what's the word I'm looking for? This is based on the same idea as the keto diet, except this is something that can go wrong when people are diabetic because they do not produce insulin. This particular thing is unique to diabetics. It is not usually, it doesn't happen for healthy patients who go on a keto diet. I just want to make that little tidbit clear. So when the body starts producing ketones as a result of breaking down fats, you start to smell the ketones as it's metabolized through the body. Your breath starts to smell like fruity. But the problem is that they're super acidic and the body can't deal with that acidity. So it starts to lead to all these side effects. Loss of consciousness is pretty severe. Most people don't like pass out or anything. But again, ketoacidosis and the keto diet, just I don't want just the idea to pop in your head that these two things are really related. The keto diet is not recommended for diabetic patients for this reason specifically. Okay, so someone's having a diabetic emergency. My advice is to get them to the hospital so they can be injected with insulin, because if you inject them with too much insulin, then you can send them into insulin shock. This causes extreme low blood sugar and possibly unconsciousness. They will pass into kind of a low-grade coma. So if someone's going into insulin shock, give them something like a PB&J, just something that's got a little bit of sugar in it, a little bit of carbs. You know, everyone says give them a piece of hard candy, and that will help kind of in the short term. But if someone's going through insulin shock and has super low blood sugar to the point that they're about to pass out, they need something a little more substantial than a piece of hard candy. They actually need to put some food on their belly, something that's going to give them sugar. So peanut butter and jelly, classic choice, cookies, you know, anything like that. All right. So we keep talking about diabetes and we keep saying that it's really bad and that it causes all these side effects. Well, some of the primary complications of diabetes have to do with the heart and the kidneys. So with cardiovascular disease, since the body's burning all of these fats and all of these proteins, that starts to create plaque, right? The same kind of plaque that you're familiar with, creating atherosclerosis. So people with plaque that's becoming laid down on the inside wall of your arteries, this really starts to increase your risk of heart disease or heart attack and death, because arteries are supposed to expand and contract, and they can't do that when their inner lining is caked solid with gunk. Plaque is most often associated with diets containing lots of red meat and fat. You can't really affect the cardiovascular system without affecting the lymphatic system as well, since the two are both circulatory system. So because of the atherosclerosis, we're getting poor blood flow. And if we get poor blood flow, then the pressure balance is off and fluid cannot be taken back into the blood vessel. So that interstitial fluid is not able to get recycled into the lymphatic system. It just stays, it turns into edema. So edema will start to accumulate in the extremities. It's usually most noticeable in the ankles because that fluid responds to the pull of gravity. Since your blood sugar is off, that's also throwing off immune system. So we're likely to develop ulcers. The poor circulation leads to sores that don't heal properly. So then they start to get infected. This can lead to gangrene. This is why people need to have their feet amputated. This is why diabetics have to check their feet. Are you guys familiar with this one? Because the blood sugar damages your nerves, you start to lose sensation in the extremities, like in the feet. So if you step on something sharp and you cut your foot, you don't really feel it. So you don't really notice it until you realize you've tracked blood all over the house. So diabetics have to check their feet pretty frequently to make sure that there's no cuts or sores or scrapes or anything like that, because if they get infected, the person may not feel them if they're not checking their feet regularly. And if the infection gets bad enough or it becomes gangrenous, then the foot or the leg may have to be amputated. So related to the cardiovascular disease, right, with the plaques that are developing in the arteries leading to atherosclerosis, you can't affect the circulatory system without really affecting the kidneys as well, because the kidneys filter the blood. And so if the blood is full of fats, which are what's accumulating inside the arteries, then those fats start to gum up the filters at the kidney as well. So as the atherosclerotic plaques start to accumulate in the blood, high blood sugar is diuretic. So we start overworking the kidneys, pumping out a lot more fluid. And so it starts to push the kidney function. We're pushing more urine, and the urine or the blood that we're filtering to make that urine is full of fat, so it starts to gum up the works. We also have extremely delicate blood vessels in the eyes. And again, we'll start to get impaired vision with the poor blood flow. Our cells in the eyes need insulin. And if they can't get their blood sugar, then it causes cellular destruction in the eye. So cause things like macular degeneration. And it's one of the reasons why it's very common for people with late stage diabetes to start to go blind. And again, we've talked about the nerves. Peripheral neuropathy, poor blood flow will cause nerve damage from high sugar being in the blood. This will start as kind of numbness and tingling, but as it continues to get more severe, you'll start to get pretty serious numbness of the hands and the feet, to the extent that, like I said, they can step on something and cut their foot, and they don't really even feel it. Good stuff so far? Good stuff. Okay. So for massage therapists, diabetes is indicated for massage. Unless there's compromised tissue, which means they may not be able to handle circulatory massage. Compromised tissue could mean if they have sores on their feet, we avoid the feet, but we can still massage the rest of the body. You want to be tend on the gentle side rather than on the firm pressure side. Get lots of feedback. And if you know you have clients who have diabetes, it's usually pretty good to keep a good idea, just some snacks or some little candies or something like that on hand. In case they get low blood sugar, you can give them something. If they report numbness or tingling in a certain area, we want to avoid the area. The word the slideshow uses is paresthesia. Paresthesia is the medical name. I will describe it as, when you go to sleep and your hand gets that like static feeling, it's just like all that weird tingly kind of like static feeling. That's paresthesia. That's it. So if they're feeling weird, numb, tingling, pins and needles kind of thing, avoid the area. And if you're working on diabetic clients, be a bro. Do someone a solid. Examine their feet, examine the back, look at the back of their legs, really look. And if you see anything that looks infected or looks like it's not healing properly, just mention it to them. They may already know about it, but at the same time, they may not. And pointing something out early where they can get intervention and start getting antibiotics, to get the infection under control, the easier it will be for them, the better it'll be for you in the long run. All right, next condition. Well, first, any questions about diabetes? Cool. All right, next condition, hypoglycemia. Hypoglycemia, when you break the word down, is a below sugar blood condition. What we're saying is you've got low blood sugar. Usual signs and symptoms is irritation and hunger. You probably have had hypoglycemia many times in your life. You probably just said you were hangry. Yeah, you know what I mean. When you get really hungry, so you get really irritable and you start to get, you can't really think straight because you're so hungry. You're really like grouchy at the waitress as she's trying to take your order. Confusion, sweating, headache. Hypoglycemia can be caused by a lot of different things. It's usually not a condition itself. It's usually a side effect of some other condition in the body, like a hormone imbalance, or stress, or infection, or you could be fasting. I mean, you'll have low blood sugar if you don't eat. That'll do it too. So if someone has low blood sugar and they're coming in for a massage, generally speaking, if they're just hangry, just eat something. Just put something on their belly. They'll feel a little better. No big deal. But if the low blood sugar is something that's recurring for them, right? They have to carry, hard candies around with them, or we know that they've been diagnosed with some other condition, then I would say work with them to try to meet the client where they are in terms of their lifestyle choices. If it's becoming a medical emergency that they're like fainting and stuff on your massage table, then I would call an ambulance. But you know, if they're just a little, usually you're gonna get the hangry type person. So if they're hangry, give them a Snickers. But if they're passing out and falling off the table, and you know, I would call an ambulance. Hyperthyroidism. We'll talk about this one and then we'll take a quick break. I've thrown a lot of really big words at you guys over the last hour. So we'll finish this one, we'll take a break. Hyperthyroidism. We talked about this one earlier. The thyroid is kind of like the boiler engine for the body's metabolism. So when this guy gets hyperactive, we start producing too many of the hormones, right? Too much T3, too much T4. This results in increased metabolism, increased heart rate. People get super anxious, super jittery, increased activity. You'll see people like wandering and pacing around, think like someone with ADHD. They become very thin because they're burning so much energy. They use all their fat reserves up, so the person loses weight. Because they're burning so much energy, their cell metabolism is going so quickly. They're producing a lot of heat waste, so the body temperature rises, so they are warm to the touch. They may also be a little bit sweaty, so they might be a little moist. And insomnia, because you know, when your fires are burning, you can't really sleep. The vast majority of cases, this is an autoimmune attack on the thyroid. So the thyroid becomes under attack, so it starts overproducing. Some of the complications are goiter, which maybe your grandparents can tell you about this one. Goiter was a big public health emergency in the United States back in, I want to say the 30s and 40s. Goiter is an enlarged thyroid, and it looks like a huge baseball-sized swelling right on the front of your throat. It really sticks out. It's very noticeable. But this was spreading across the country back in the day. And the cause for this one was a lack of iodine in the diet. And so the solution was to add iodine, which we only need trace amounts, tiny, tiny amounts. So we added iodine to the salt, which is something that everybody used, and it was common, it was in every house. This is why you have iodized salt, to make sure that people are getting enough iodine in their diet to reduce the public health risk of goiter. I'll pull up a picture just in case you've never seen it before. When we talk about goiter, I totally spelled that wrong. I mean, look at that. It's like, it's noticeable, man. It's huge. Now, obviously, Google is going to pull up the most extreme pictures. So keep that in mind, you guys. Most of them do not look like that. Most of them look more like this. There it is. Right there on the bottom. Not like where her Adam's apple would be, but like right here on the bottom. Do you see how it's like distended outwards? Yeah. So if this was interesting to you, you should read the whole Wikipedia article about why we started putting iodine in the salt, because everybody was getting goiters. And when we started putting iodine in the salt, all the goiters went away, and it was a huge public health success. It's a fascinating story. I encourage you to read up on it. It was fascinating. So back to my main point, those goiters, also a side effect of hyperthyroidism. If the thyroid starts overproducing too quickly and we start to kind of overload the body with really, really high amounts of those hormones, then we start to see a condition called a thyroid storm. This creates things like heart palpitations, confusions, psychosis. This is rare. I've been doing massage for a really long time, you guys. I've never seen one of these. but it is something to be concerned about with thyroid hyperactivity. The way that we treat hyperthyroidism is usually either kind of using some kind of like chemotherapy to destroy part of the thyroid, or we just surgically remove the thing altogether. Either way, awesome, you're no longer overproducing all those hormones anymore, right? Good for you. But the side effect is now you're underproducing all of those very same hormones. So often the treatment for hyperthyroidism will result with hypothyroidism. And that is going to be the condition that we talk about next. So for hyperthyroidism, it is not contraindicated. You are more than welcome to massage these people. It's going to be very calming type of massage, right? Very relaxing. Remember, they are very kind of irritable and energetic. So you want long, flowy strokes, very slow pressure, nice and relaxing. Nothing too deep, nothing too jostling, nothing too aggravating, nothing too stimulating. Also, if they have hyperthyroidism, I would avoid working on the front of the throat. I don't want to bring more blood into the area and stimulate an area that is already stimulated. So I would avoid the front of the throat and just keep the massage very relaxing. All right, hyperthyroidism. Good stuff? Good stuff. All right, let's take a 10-minute break. When we come back, we will pick up with hypothyroidism. I will see you guys in 10. Alrighty, we are back. Okay, so we left before break talking about hyperthyroidism. Tonight we're going to continue talking about hypothyroidism. And hypothyroidism is exactly what it sounds like. This is going to be a low thyroid function. So in many ways, this is the opposite condition. So we thought about hyperthyroid people as having way too much energy. They're running really hot. They're super thin. With hypothyroidism, they're cold and they're intolerant to cold. So they're cold and they get cold very easily. Their skin is usually very cool and dry to the touch. They also may gain weight, so they be physically larger. Menstrual irregularities, constipation, depression, goiter, fatigue, just not really feeling too great about themselves. Hypothyroidism can usually be corrected with medications, although, again, this is a kind of a category of things, so a lot of different things can cause it. We are just here talking about what the kind of the general symptoms are. So reasons people could develop hypothyroidism: certain autoimmune diseases like Hashimoto's, or it could be caused by the treatment for hyperthyroidism. This could also be a congenital birth defect. It may stunt the growth of the person. Let me think. You guys may have heard someone use the insult and call someone else a cretin. So a cretin was a medical term. It was a person afflicted with cretinism. Cretinism is a congenital hypothyroidism. It's something that you're born with, and it causes a person to grow into it with a shorter stature. So this is different from like your classical dwarfism. So congenital birth defect, that's the one we're talking about cretinism. And then idiopathic. When a disease is idiopathic in nature, it means we don't really know what caused it. So most commonly hypothyroidism onsets after some stressful life event, but we don't really have a mechanism to explain that. For treatment, since the condition here is low thyroid hormones, we could supplement with oral medications. So we just give you those hormones in pill form. Those could be synthetic, natural, or compounded by a pharmacist. And the idea here is we're trying to reignite the body's fire. So we're trying to use things that will stimulate the body: exercise, diet, stress reduction, stress management. Massage is definitely indicated for this condition. It will help circulation, helps control mood, as well as helps them sleep. All right. So for the adrenal glands are most famous for their role in the stress response. They're stimulated in response to stress. This would be a sympathetic nervous system function, right? You guys who've had me before, remember the sympathetic system is Spider-Man and the parasympathetic is Peter Parker. So rest, or you've got your fight or flight response, and then rest and digest. So when the sympathetic nervous system fires, and we've detected stress, so we begin the stress hormone response, cortisol is released. Cortisol will begin to help break down carbohydrates, proteins, and fats so that we keep our blood sugar up in times of stress. We want to have plenty of energy available in the blood on hand in case I suddenly have to start running away from a bear. We will decrease inflammation in the short term. Again, if I twist my ankle running from the bear, I cannot stop to tend to my wounded ankle. I have got to keep running. You won't even feel that sprained ankle. It also inhibits collagen production so that we free amino acids up for use in energy. So instead of building new structures in the body, we are instead going to use those bricks to burn for fuel just in case we need them. Another hormone at play is aldosterone. This is regulating sodium and potassium related to your blood pressure. This is dealt with in the kidneys, as well as androgens, your sex hormones. Testosterone will be produced in both men and women to increase feelings of aggression, but also all of your reproductive functions start to slow down under the fight or flight response, to the point where menstruation virtually stops. Anything that was moving in the reproductive cycle tends to become inhibited during the fight or flight response, and then it will return to function once we return to the rest and digest parasympathetic mode. So again, we've got our adrenal cortex, which is the outer layer, and then the medulla, the inner core, each producing their own hormones. This is just a rehash of what we talked about earlier. Can anyone name that character? Anyone remember who that is? Anyone?
They're not from Kim Possible, are they?
Yes. Yes. No, no one. Her name was Adrenaline. Yeah. All right. Addison's disease. So Addison's disease is adrenal hypofunction. So the adrenal glands aren't producing the hormones or enough of the hormones that they're supposed to be producing. This is idiopathic atrophy of the cortex. So we don't know ultimately what caused it, but the outer layer starts to deteriorate. And so all the hormones that it's producing also start to have lowered outputs. This usually is autoimmune, but this could be because of neoplasm. The word neoplasm means a new growth. That is code word for tumor. There is a tumor growing on the cortex, and that's why the cortex is not functioning. So autoimmune could be a tumor, could be inflammation, could be iatrogenic, which means it's caused by medication. Like the condition that we're looking at is caused by some medication that we introduced into the body. So here's how this would work. If someone is being given artificial hormones like steroids, if you're being supplied through medication with hormones, then your body will not produce those hormones on its own. Its own hormone production will start to go down because you're getting the hormones through the drugs, right? Right. So what happens when you stop the drugs? Bam, now we have a low functioning adrenal gland, and it's going to take time for the function to start to raise back up again. So when we say that it could be caused from an iatrogenic stance, what we're saying is it's caused because of some medication that we gave the person.
So is that why with some medications, they tell you, like my daughter was on something a couple years ago when she was sick, and they said to take it, it was for like 3 weeks, she took a regular dose. And then for the week after that, she took a half a dose. And then for a week after that, she took a quarter dose. Is that still that like your levels realign themselves when you're cutting off the synthetic?
It sounds exactly right. That sounds exactly like what he was doing. Yeah. And for certain things like hormones or neurotransmitters, the body cannot handle a sudden, like, you know what I mean? If you're being given those medications artificially, and so your natural production has gone down, if you just stop that medication, the body cannot handle it. This is why many psychiatric medications, you can't just stop taking antidepressants or bipolar medications and things of that nature. When you start twiddling with people's neurotransmitters in their brains, you just like what you were saying, you've got to wean them off of that medication, return functioning to normal, and then introduce the next medications. You got to be weaned off of one drug before they put you on the second drug. So the short answer is yes, it sounds like that's exactly what your doctor is doing. Yep. And certain medications are no big deal, right? Certain medications, you can take them for years and then stop taking them and the body won't really react that way. But again, when you're talking about hormones or neurotransmitters or things of that nature, particularly things that the body can produce on its own, if you start artificially supplying those materials, then the body will stop producing them on its This can cause a lot of problems when we try to stop the intake of that drug. Cool. So we said autoimmune, we said cancer, we said inflammation, and we said caused by other medications, iatrogenic. It could also simply manifest in terms of stress or trauma, which would be another idiopathic cause, meaning we don't really know what the cause is. Signs and symptoms of Addison's disease: hypotension, low blood pressure, low blood sugar, decreased resistance to infection. So they don't, their blood pressure is low, they've got low blood sugar, they're probably going to be feeling a little tired, a little fatigued. Their immune response is not going to be so great. Decreased cardiac output, the heart isn't pumping as much blood when the pressure drops, right? So one is directly related to the other. And a change in the pigmentation of the skin. This one, I feel like this is the one that I'm thinking of. It's a little difficult to see. Yeah, it's a little difficult to see, I think, over a computer screen. But what you're looking at here are the same person's hands. Let me see if I can find it. All these pictures are so small. So you're looking at the hands of the same person, but if you look, you'll notice that they're two different skin tones. Like even the palm side, just the base color of the skin is just a few shades off. I don't know if you guys are actually able to see it through your computer screens, but if you pull it up on your phone or something like that, I just Googled Addison's disease. Here's another photo. So the darkening of the skin in Addison's disease, sometimes referred to as bronzing, usually develops in the areas of the skin that are exposed to direct sunlight. For the patient, the particular coloring will appear unnatural. Hormones, man. They do funny things. Okay. This can also lead to Addisonian crisis, a life-threatening situation that results in low blood pressure, low blood levels of sugar, and high blood levels of potassium. You will need immediate medical care. People with Addison's disease commonly have associated autoimmune diseases. So for an Addisonian crisis, we are looking at a severe drop in blood sugar as well as blood pressure. And you'll hear people a lot of times like a sudden marked drop in blood pressure, that's fainting. So if your blood sugar drops too quickly, you faint. So they get really lightheaded, they might faint, they may just get really loopy and lightheaded, dizzy, have to sit down, but they do need to go see a doctor. If someone has Addison's disease, it is very likely that because it's so comorbid with other diseases, they very likely will already have a diagnosis. They will know that they have Addison's and it will be on their intake form. You're usually not having to play guess games with conditions like this one. So for massage considerations, I would really much like to talk to their doctor just to make sure, or have a really complete medical history so I know all the conditions that we're dealing with. Since the cardiovascular issues are present, so we may have decreased circulation or really low blood pressure, I'm going to use really light pressure. I'm not really going to go deep or anything that's going to put stress or strain on the body. Also, if they've been treated with corticosteroids for a really long time, like over a year, they could have bone thinning. So be a little careful going over the ribs. Really don't put too much pressure on them. Bones can be a little more brittle than usual. All right. Our next condition, and I feel like we're coming near the end. Yeah, we are almost done, guys. Next up, we have Cushing syndrome. So previously, we were looking at Addison's disease. Addison's disease was caused by adrenal hypofunction. So not enough is being produced. Cushing's would be the opposite condition. We are producing excessively high levels of cortisol for long periods of time. This could be caused by damage to the pituitary gland or a malfunction in the pituitary. This could be caused by adrenal tumors. This could be caused by lung tumors, or it could also be iatrogenic. Again, iatrogenic meaning it's caused by medication. Sorry, I had like a brain fart. So Cushing syndrome leads to very distinctive symptoms. One of the most notable is the rounded face. Their face becomes very round as they gain a lot of weight. They start to gain an excessive amount of weight through the torso, but not on the extremities. So they end up with this really round body and then really skinny arms and legs. The body is usually marked with really broad, very wide, bright red stretch marks. So here is an illustration. Notice where the weight is held in the torso, but the arms and the legs are not kind of matching with the obesity. You'll see the dark red stretch marks. The skin becomes very thin. They bruise very easily. And the abdomen not only hangs, but it hangs down. That's why the term that this thing uses is pendulous, but it's marked by its hangingness. The distinctive rounding of the face. Here's another example. There's that classic half moon face. Just the way that the face is almost inflated versus, I don't know, it's kind of hard to describe. And then there's Cushing's stretch marks. Very wide, very red stretch marks. Okay, so now we've seen Cushing's. It's caused by really high levels of cortisol for a really, really long period of time. So it's promoting inflammation, it's promoting fat storage and weight gain, thinning of the connective tissues, thinning of the bones due to the high presence of cortisol, menstrual irregularities, hypertension, high blood sugar, and possible diabetes mellitus. It may lead to diabetes because of the high blood sugar. There's your classic Cushing syndrome, red cheeks, moon face. And I just threw on lots of pictures so you guys would have some different stuff to look at, because it hits everybody a little bit differently. But once you've seen a few of these cases and you know what to look for, you'll spot them. Oh, one of the other characteristic signs is a fatty pad that places itself right over C7. So there's like a fatty lump of tissue right there. You notice the distinct curve at the base of the neck. All right. So can you work with clients with Cushing's? The answer is yes. Light pressure, because of the possible circulatory issues. They may also have diabetes. So anything with diabetes, you should have to take that into account as well. They may also have immune system problems. So I'm going to be very gentle. And they also may have bone thinning. So I'm not going to use really firm pressure, particularly over vulnerable bones like your very thin ribs. So no like dragging your elbow down the spine. Good stuff. Right. how are you guys feeling? Any questions? Anything we want to talk about? Do you guys know anyone who's had any of these conditions? Anyone got a family member or family friend with Cushing's or Addison's? No? No one?
Nope, sorry.
That's okay. Good for you. I mean, that's good news. All right. No other questions? Nothing else? I know we talked about a lot. All right, guys. Well, I know it's a little early, but I'm not going to keep you here for an hour and a half if I don't have anything else to say to you. I'm kidding. I'm kidding. That was a joke. Oh my gosh, guys, that was a joke. All right. I will see what I can do about getting these slides posted onto Moodle. I will see what I can do about getting this recording posted onto Moodle. You guys will have that for your references. And if you have any other questions, you should talk to your instructor, who's not me, because I'm a sub. All right, you guys enjoy your night. It's been a pleasure. I hope I see you all again. And some of you, I know I will definitely see you later on this week. So no calling out of class. I got you.
Friday.
Bye, everybody. Have a good night.
Thank you. It was nice
Later.
to see you again.
Thank
Me
you.
too.